So today we will be performing your breast surgery.
Lifts.
Yeah.
Implants change thingy.
Do you want to change implants? Okay, we will check.
Let's see.
And can you come here? You have called waterfall deformity, and it's looking like a tubular breast now, but you don't have tubular breast. It's a deformity after augmentation. Your implants, are they under the muscle? Or my suggestion will be, if you are happy with the size, if you don't have any problem, we can keep implants same.
Because when I put my arm up, this is gorgeous. This line is good. It's just like my own breast line.
Yes, and
so
it's
this just needs to go.
You explained it very well, and this we call waterfall deformity because it's folding over the implant. Can you come here? Yes.
And they're very much to the side.
We can make it in the midline.
And my nipples need to be smaller.
We have a standard, it's about 42 millimeters. After the first month, you will start to use a tape for your scar, and yes, it will be silicone tape, and it will be much better.
Okay.
Yeah, we will talk about these things, but smoking is important for me, and protecting your
vape as well? No.
Then see you at the operation room. We will be taking you about in half hour. It will be a small surgery. Hello, I operated Jessie 1 year ago for a revision rhinoplasty operation. Today she came again for another surgery. She had a waterfall deformity after her breast implant surgery, and to correct this deformity, today I performed a breast lifting surgery with inverted T incision. I also reduced her nipples and repositioned them. Now operation went very well. It was around 1 hour, and now we will wait for her healing process. See you. Bye.
that is your 5th time with IMED.
Yes.
We had tummy tuck, BBL, rhino, teeth,
Yes,
and
everything.
now your breast.
Yes, the final piece.
Yes.
Yeah.
What was the problem with your breast?
I had them done twice in the Netherlands, and the first time I had a double bubble, and the second time I had a waterfall breast. I did not know what it was until Trugo told me that I had a waterfall breast. So that was the big problem, and it looked very not pretty without bra. So
Okay.
I wasn't very confident without a bra.
And how was your surgery, the total experience, hotel transfer?
Very easy, as always. Like always with IMED, it's very easy. It hurts, of course.
Yes.
But every operation hurts. But it was fine.
How are you?
I'm good. How are you?
Thank you. How's it going?
A little bit of pain in the right breast.
Okay.
But overall, I'm fine.
Okay, your stitch looks good. This one is a little bit more swollen. Because of this, it's logical that you have more pain in that part. Since I didn't use drains, you have now collections. They will be absorbed by your body. Don't be scared about it. Nipple circulations are good. I hope you won't have any problem about them.
It started to itch a little, so I was like, oh, that's
Because it's healing and
that's
you
good,
have
right?
absorbable stitches inside.
Okay.
Day by day they will be absorbed by your body and you will have more itching.
But itching is good, right?
Yes, this means it's healing.
Yes. I hope they will be like round. They
Yeah, they will be round. Now implants are a little bit higher. I pushed them up.
That's why it's hurting.
Now you have very nice cleavage, very fullness on this side. They will be going a little bit down and this will be round. I arrange your glands and they will be nice. And your stitch lines will be very nice and they will be...
The breast implants will fall over the...
Yes, and they will be fold. Yeah. And this what your bra doing, they are pushing this one. And because of swellings you feel more pain.
Yes.
But day by day it will be less.
And I started like lasering this away.
Yeah.
After how long can I start
You can
lasering
start
again?
it because
Already?
it will have no effect on healing in that part. And you can start fractional laser in that your scars about 3 months later.
I will wait, but
Yeah.
okay. Good
And
to
we
know.
can go to sauna and have tops in a month.
Not yet.
In a
One
month.
month later.
1 month later you can start.
I've been here for like 3 days. Tomorrow I'm going home, and it's just done.
Okay.
Yeah.
You have to take care about your stitches, of course. We make an anchor, reverse anchor shape scar. This means that you have to take care about your aftercare, so no smoking, no drinking, no any other bad habits. Take care that you don't lift your arms more than 90 degrees.
I don't want to. It hurts, so I don't want to. So that's easy.
Okay, and you was also busy with the tattoo removal, so you can do it, it's no problem. A lot of patients are also asking us after the surgery, can we do laser treatment for the hair removal or tattoo removal? So that is no problem because it's skin, you are treating the skin. So this one is, you can continue with all the things that you are used to it.
Perfect.
Think about 30 days, no sauna, baths and everything, but you can shower tomorrow.
Yes, and I can drive after 3 weeks, right?
Yes, correct.
So I need to drive her at home.
Yes, so you have to arrange a driver.
Oh, that will be perfect. I will enjoy that.
Okay. After the flight, you can take off your sexy socks off.
Oh, yes. Yes.
So long with the flight, it's very important that you wear the socks. And after the flight, you can take them off.
Perfect. Thank you so much for
Yeah.
everything and for the good care again.
Yes.
And the fun trip with everybody here. Literally everybody is here,
Yeah.
so that's fun.
Yeah, all your friends was here, so it
Yeah.
was really fun.
Yes. Well, thank you so
Okay,
much.
You're welcome.
And I will see you in the future again.
Yes, I'm looking forward to your post-op pictures.
Yes. Thank you. Bye.
Bye-bye.
When you send us photos, I can examine you just on your photos or videos. And sometimes we cannot make exact. When I saw your photos, you should know that I can't make exact diagnosis that you should do on the operation. And when you come to Istanbul for operation, we can change surgery plan for you. And this is because on photos we can't make exact diagnosis. Please know about this. And if we have consultation in your country, please come to consultation. This is very important for us. And you are coming to a foreign country for surgery. I know you are coming to a foreign country for surgery. This is a very difficult decision. And when you come to here, the surgery plan can change. This is just for you. Please don't hesitate about it. This is just about your body and the results. I know it's very difficult decision to come to a foreign country for the aesthetic surgery. It's very difficult, but please, we are working for your body, for the best results. Don't hesitate about it. We are looking just forward to it. See you and take care.